Hi, welcome to our first blog post for Informatics. I'm Karina.
And I'm Laura.
And we are attempting to do video blogs for our discussion posts every week. So as you've seen from our title, we like to call this Nurse Talk with Cor and Laur.
Okay, so this week the first discussion was what nursing informatics means to us and what type of technology we've used in our nursing careers thus far.
So I guess, Laura, when I first hear the word nursing informatics, I generally just think of technology, I think, how we use technology while we're nursing. What do you think?
Agreed. I think at first I really wasn't too sure about it, but as I've done some of the readings this week, I've learned a lot more in that we actually do use quite a bit of technology, more than I think, on a day-to-day basis.
Okay.
So the topic of nursing informatics was brought up as early as the 1980s, and by the late 1990s, the term e-health was finally created. So we've got two terms here. We've got nursing informatics and e-health. Nursing informatics encompasses nursing science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice. And that's from the CNA. The term when referencing to technology or systems directly related to nursing practice and care delivery.
Excellent. So Laura, another thing that I found when I was researching the topic just to learn more about what it was, there was an article I looked through called The Tug of War Between Practice and Technology. And it discussed the benefits of using the technology in the nursing practice. So for example, some systems were able to identify when trends occurred, say falls, and because of the way it was documented, they were able to discover trends that way, and how to implement different interventions in their practice to prevent some of these things from occurring. As well, the system was able to have little reminders and notifications if something was missed. And that was something they found as beneficial using the technology rather than just paper.
And that segues pretty well into the next question, which is how much or what we use at work. So you work in two different facilities. Karina, what are some of the differences there?
That's right. So at one of my jobs, I work in a long-term care home where we use the EMR. And that all the documentation is done on the computer, and we have little tablets or computers that are on the medication cart that we take around, and everything is documented right on the system. So we sign off meds that way, we make nursing notes that way, even if we're writing a note to the doctor referring to a different member of the team, we do it all through that system. Now, at the hospital, there are some similarities, but also some differences. And Laura, you work there as well, so maybe you can talk about what we do there.
One of the newest things we have at the hospital is our, some people call them nurses on wheels, I guess, but our vital systems. They're connected to the Wi-Fi at the hospital, and we just sign in, scan our patients' armbands. All the information that goes into the vitals machine gets automatically sent to the patient's chart. So we don't have to go back and spend all that time charting. Our glucose monitoring also scans us and scans the patient, and that goes directly into their charting system. And that's a big time saver for the most part when it's working, but technology can be finicky.
That's right. And we do still use paper charting at the hospital as well, or at least that's how we sign off on our meds. And what we've both learned is it's important to still write things down for when things don't work out.
Yes.
Although there are many benefits, of course there are those times.
Yeah.
So I guess we pretty much covered what we wanted to for this week on this discussion post. So please feel free to comment, ask questions, and we will have to...
We'll see you next week.